In studio, we want to have an interactive session. We want to understand just what goes into having a mobile clinic, and a mobile clinic specifically targeting workers who may have long working hours, not finding time to go for medical checkup. What does that entail? The CEO of Checkup's Medical Hub, who is Faith Mungai, is with us in studio. Thank you for joining us, Faith.
Lovely. Thank you for having me.
Could you just take us through what this mobile clinic is all about?
Wow. So let me just step back and say COVID-19 opened a Pandora's box, and it actually lends to the fact that we need to start looking at things and doing things differently.
Right.
And so Checkup's Medical Hub launched our mobile clinic services last week. What we're trying to do is revolutionize the way healthcare is provided and take care to the people. The mobile clinic offers full diagnostic capabilities, full consultative capabilities, as well as treatment capabilities. We have the ability to go out into communities and target wananchi at the community level. We also have the ability to take our services to corporate entities and provide wellness services as well. So we're trying to expand on quality, access, and affordability at the convenience of the people that we serve.
Right. So what is the gap that this service is seeking to fill right now?
Well, with the pandemic, like I said, there's a stereotype and a stigma of people trying to go into healthcare centers. But we all know that there is a need. And so in terms of filling a gap, we're actually providing accessible services by a B2B or a door-to-door approach, where we're able to penetrate communities and park ourselves there and actually offer comprehensive services to the communities and clients that we're serving.
When you talk about affordability, many Kenyans do not seek medical services because they cannot afford, so they end up self-medicating, you know, or just going to the doctor maybe once in a whole year for any checkup. What do you have to say that about this service now coming in to fill that gap?
Well, it's all about education, and the more that we go to the people, the more that we're bringing information and having them not use just the most convenient intervention, but trying to state the safety of the intervention. So by our services being able to penetrate the communities that we're serving, we're actually being able to touch and speak and inform and educate people on what is right, and so that they can access care in a timely and appropriate way.
And when you talk now, the services that you offer, do you offer treatment, or it's just checkup and diagnostics, and now someone goes to a doctor for treatment?
So when we look at that bus, I actually say it's a hospital on wheels.
All right.
Literally, we have a physician, we have a nurse, we have a fully decked lab, we have x-ray capabilities, we have a pharmacy, we have an echocardiogram, we have a ultrasound, we have an EKG. So when we say that, it's actually literally a hospital on wheels, where we're able to consult and provide diagnosis, we're able to screen, we're able to provide comprehensive diagnostic services, and we're able to treat. So we're not sending you anywhere. It's right there at your convenience. It's a one-stop shop.
Could you speak to the disparity in healthcare, especially in the urban centers? You find that people who may be working and have a lot of money can afford private healthcare. There are others in the blue-collar industry, maybe they work long hours, they cannot afford healthcare, or even lack the time to go to the hospital.
Yes, and so when we look at our typical health system, we see there are long lines, and when we stay and there are long lines, there's no medicine and so on. Staffing is wary, and so people actually are agnostic of going into healthcare facilities because they're scared about the wait times, the quality of care. Will they be provided a service? What about professionalism, friendliness, and so on and so forth? With the mobile clinic, once again, one-stop shop. But number two is making care convenient to people. So we bring care to you, and we are servicing you. And so no longer wait times, no longer, customer service issues and so on. We are fully decked, we are fully stocked, and so on. So once again, trying to provide a convenient but a wholesome experience where in the communities that we're serving.
During this time of the pandemic, hospitals have been highly overwhelmed, say, by the patients that are going in. The infrastructure that we have currently has been tested, really. So what do you think this kind of innovation is bringing into the market?
We're actually looking at, and I keep on repeating myself, but it's mobile, so it's going to. We've been looking at partnering with border control at Malaba and so on and so forth to actually conduct PCR testing and so on. We actually have a fully pledged lab at the JKIA, but once again, providing a solution to not only corporate entities, but even at the community level. How do we take screening, PCR testing, and so on, so that we're able to actually address the current need?
Right. And how can someone access these services?
So once again, we have a website, but we are actually through the launch is actually building relationships, and we are looking to garner relationships with not only corporate entities but also SACCOs, churches, and so on and so forth. We offer chronic disease management, we offer maternal child services, we offer wellness services. So we are actively seeking to partner, but we are also available and accessible through our website, social media, and so on.
All right. Now let's talk about the access to health for the county governments, or county governments providing health services to the people. Of course, we know that Kenya, there are far-flung areas that do not have access to medical, maybe even clinics are very far away. Do you think this is the solution?
I think it's one of the solutions. I mean, when we talk about maternal mortality rates in Mandera, Isiolo, and so on and so forth, and the lack of healthcare centers, infrastructure, and so on, we then become the solution, because once again, we're going closer to where the need is. And we're also providing a one-stop comprehensive solution. And so we're also building adherence to care, because we're able to provide a holistic solution that is end-to-end.
All right. So as we come to a close of this conversation, what would you tell maybe people who are seeking such services and want to find them? Just give them your parting shot.
It's about quality, it's about affordability, it's about convenience. Please feel free to check us up on checkups on our website. Feel free to call us to book screenings and so on. We will come to you. We will bring our mobile solution to you, and we'll provide you holistic services.
Right. Thank you very much, Faith Mungai, the CEO of Checkups Medical Hub. We have been talking about matters healthcare, access to healthcare, and bringing healthcare to you.